Happy Monday, everyone. I'm Deepika Grandhi with Cleveland Clinic, and I thank Voice of Healthcare for bringing me back today to host a distinguished guest, Dr. Aloke Mullick, who is the CEO of Omni Hospitals. A very good evening, Dr. Aloke.
Good evening, Deepika. Good
How are
seeing
you
you.
doing today? Must have been a
Wonderful.
busy Monday.
Oh, yeah, it was busy. Hmm.
Well, I'd like to start off the session today with a quick rapid fire round of introduction so the audience gets to know you better. My first question for you is what motivates you as a leader?
Yeah, Deepika, I worked 5 years in IT, and the thing that really messed me up there was there weren't many people to talk to, right? And for that reason, I went into consulting while I was doing IT, though I was there basically doing a lot of other things. But then I went into consulting because meeting people, getting smiles on their faces is what drives me. That's
Oh,
why
that's
I have a great focus on patient experience.
okay.
See, if I can get
Well,
my team knows my mantra for them is make 5 people smile every day.
make people smile,
Make 5 people smile every day.
make five people smile. That's
Yeah.
great. I'm sorry, I'm having some hearing problems on my end, I guess.
Mm.
The one
Okay.
thing that's in your bucket list.
Hmm. Um, that would be probably um, to create a totally paperless hospital environment from
Oh, wow,
scratch. Yeah,
that's outstanding. I know we both share passion for technology, and I'm sure
yeah,
in our lifetimes we should be able to see that with where India is right now with healthcare
yeah. With
technology.
India is usually budgeting issues and so many other adoption issues, budgeting issues. But that's definitely one of my dear things in my bucket list. And of course, out of my profession, the bucket list is to help as many people to meditate as possible. I'm a meditation trainer. Yeah.
Wow, that's motivating.
Hmm.
One word that comes to your mind first when you hear 2021.
COVID, obviously.
Post, yeah, and one word that comes to your mind when you hear of the word technology.
It's interesting. If you say technology, the thing that comes to my mind is Amazon, right?
Yep.
Technology should make life simple, right? You should be able to access whatever you want, and information is there at your fingertips. You can make your purchase decisions. You can make informed decisions, right? And this is what is not happening in healthcare today. You got to get into
Okay.
queues, you got to do bookings, you got to do this, you got to do this for a simple transaction of just having to go and show your medical reports to a doctor. You got to jump hoops, right? You got to actually plan for it for a week, for a 5 minute
Right.
visit to the doctor. It's amazing, it's crazy. And
Right.
people are not going to accept this. And the hospital and the health system in India, which is going to own the patient's mobile for the first time, they're really going to reap the benefits.
Yeah. Yeah. Technology, and I think, in other words, is powerful, but we have a long way to go in making sure
Oh
we
yes,
use it
well,
to
all the
its full
pieces are
potential.
there. It's a mental block. All the pieces are there. There's nothing to be invented. There's nothing to be. And the pieces are pretty cheap now. There was a time when they were very expensive. The pieces are very cheap. It's just
Sure.
that people just don't care right now. But things are
Matter of
changing.
adoption. I'm sure
Yeah,
we'll get
things are
there.
changing.
And
Yeah.
what's the one word that comes to your mind when you hear the word Indian healthcare?
Um, used to be cheap, but used to be cheap.
How about now?
The Indian healthcare inflation, private sector healthcare, year on year has been 15 to 20% for the last many years.
Hmm.
I always give people an example that a Hero motorcycle entry level model used to be 35,000 say about in 2005 was 35K. Today it might be 65K. A hernia surgery in 2005 was 25,000. Today it's 1,50,000.
True.
Just just gone through the roof.
Yeah. I guess,
Things have
healthcare
happened.
and quality both come at a cost. And we all need it. It's imperative. Well, I think so. Diving into our topic today, thank you for that wonderful round of introduction and sharing your perspective with us. I often ask the question these days, are we done with COVID yet? And, I'm sure most of us would not be able to give that answer with certainty. Although I'm sure that, all of us as healthcare leaders, as caregivers, and organizations such as Voice of Healthcare are eager and energized, to move into the future and to become a part of the revolution and the transformation that's going to happen in healthcare following COVID. I'm sure we all will agree. Um, and also that COVID-19 has made even the most powerful of the countries, the developed countries, really grapple. And I think India has done a phenomenal job in taking the center stage. But before we start talking about, what's next and, where is healthcare going to lead in post-COVID era, I want to take a moment to reflect on 2020, especially for hospital leaders such as you. There was a lot on the table. On one side, y'all had to make investments in, procuring PPE kits, in equipment, and almost overnight making sure you have a digital platform to offer OPD consultations. And on the other side, I'm pretty sure hospitals across India have seen a sharp decline in revenue, be it due to delayed elective procedures or perhaps almost, absent medical tourism due to, the international borders being shut. uh, that was a tough year, for leaders such as you. And I really appreciate, the leadership that you all had to present, the community with. What are your experiences, Dr. Alok, as you reflect into 2020?
Talking about the past year or the coming
The
year?
past year, how did you handle the situation?
See,
The
past
declining
year,
revenue, the investments,
yeah, yeah.
managing the
See, it
patient's
wasn't
safety, the employee morale.
there's a lot of hullabaloo being made that we had to invest a lot of money. It's just that management, many hospitals had management teams who didn't react fast enough, right? I still remember when it hit the ceiling. I think in end of March, and we knew that this is really bad. This is going to affect us, and immediately because there is a lot of scare about COVID, right? People are scared, and the scare is usually spread by lack of information. We started intensive training sessions for all our caregivers, including doctors, to be given by specialists whose job it would be to treat COVID, the pulmonologist and the internal medicine guy. Intensive training sessions so that the scare went away. And then, of course, initially India did struggle for PPE kits like the rest of the world, and everything was coming from China. I still remember from Hyderabad we were sending our ambulances to Nagpur, which is the central air hub for commercial transportation.
Hmm.
And these guys used to line up there, and moment these kids were coming out, and they were kind of, it was an informal auction, and they used to bid and get it and fill up the ambulances and get back. For small hospitals, we used to procure stuff for 10-15 lakhs every month. That used to pinch at that time. But then the amazing resilience of Indian industry kicked in, and the things that we were buying at probably 25,000 a piece, 2,500 a piece, came down dramatically in in 200, 300 rupees, right? So the market got flooded. So
Hmm.
everything got available, the medicines got available, the kits got available, and the doctors got trained, the staff got trained. Initially, the nurses ran away, right? So we called them back, we talked to the parents, we told them if anything happens, they'll be treated free of cost, don't worry. Some people did get infected, they were all treated, and luckily nobody died, right? And out of
Good.
6 hospitals that we have, 5 are COVID treatment centers, and they all did well, right? But only in April we dipped. because obviously we were not yet treating COVID, and we were kind of the non-COVID patients just disappeared except for the emergency. Like hospitals typically one-third emergency, two-third planned, right? Two-third disappeared. So April was a marked contraction. By end of May, we were 85% year on year.
Wow,
So
that's
it didn't.
phenomenal.
Yeah, yeah. But
So
then
there is no, in other
I
words,
know of hospitals which took time, which took 3 months, 4 months to recover. That's because probably they didn't react proactively, right?
okay.
No major investments were required. Trust me.
Yeah, so from what I hear from you, to recap, resilience, collaboration, economies of scale, and really what we call jugaad in India has really worked.
Yeah, yeah,
To get the hospitals back in place.
yeah,
That's
yeah.
thank you for those wonderful words of wisdom. Now, just reflecting back, I really believe that this pandemic has made me believe more in the concept of Atmanirbhar Bharat. I feel like we saw in India that was reflecting more on competence rather than competition. Believed in not looking inwards, but I really feel that the country has reached out to other countries in times of help. And with that unparalleled ecosystem, the startup ecosystem, I feel this is the perfect time to start talking about healthcare investments. So what are your thoughts, or on what are the factors that would positively influence the healthcare investments, both internationally and domestically, for India in the healthcare sector?
It's surprising. I mean, see, investment is very, very sentiment driven, and I'm surprised that the sentiment is still negative on healthcare. Sentiment started going south when the government started trying to control the healthcare system, and they had no choice because the inflation was running rampant. Rates were just going out of the virtually off the charts, and everybody was charging just whatever they wanted to charge. That is not happening. I mean, so ultimately the government is responsible to the population, right? So like our governing philosophy, like we operate in the lower middle class to middle space, and we offer corporate hospital care at nursing home prices, right? Most
Mm-hmm.
of our charges are 50% of what any other corporate hospital charge. Still we have industry leading EBITDA margins because we have ensured that there is an extreme amount of cost control. You'll be surprised how much hospitals leak, how much, I mean, most hospitals won't even have a cost accountant to their costing. So those happy days are over, that you can just to improve your margins, just keep on raising your rates. That's not going to happen anymore. And it's
Right.
right, it should not happen. It should not happen. Why should the general inflation over 15 years be 100% and healthcare inflation be 400% or 600%, right? That's the way it is.
Right. Now, what are your thoughts on, the impact of a patient experience on, this modern and advancements in technology? We've seen some hospitals in India who've made significant progress in making sure there's online appointments. They're doing all kinds of surveys to understand the patients better. Where do you think the hospitals should make appropriate investments to really enhance patient experience?
Yeah, I'm happy you asked that. The more technology you use, the less you actually talk to our patients. The individual human touch points are reduced. And those individual human touch points actually make the patient feel comfortable with the hospital or with any service given. Why is an Apple store a great place to go and buy stuff? Right? They make you feel nice. They make you feel that you are the most valuable person to them, right?
No, I hear you completely.
Yeah, and you go to a hospital. I mean, they might be charging a huge amount of money, humongous, but then you look at the way most hospitals treat their patients. Most hospitals, the junior staff treat their patients, right? Take it or leave it. बताया ना डॉक्टर नहीं है, बैठो अभी जब आएंगे तो बता देंगे. The tone, right? It hurts patients every day. I'm paying for this service, and look at the way these guys are talking to me. But he's sick, he's scared. He has decided, because whenever a patient wants to go to a hospital, the first box that he ticks is the doctor should be good. Once he has ticked that box, he's kind of stuck there. Okay, this doctor says only I have no choice but to come here. Many a times, the doctors are asked by patients, "Ki Doctor Saab, I really want to get my surgery done by you, but can you do it in some other hospital?" I say, "I don't like this hospital."
Yeah, no,
One of my,
that's
one of my
that,
best friends, he is in Chicago. Sorry, just a small anecdote,
sure.
and he has been sick and he's gone a few times for some major procedures. So I asked him, "Ki, which hospital do you go to?" So he said X and Y. I said, "Why? Great doctors." So now all hospitals have great doctors. So tell me, why do you go to X? Oh, X, whenever I go there and this ER, this nurse is there, and the moment she sees me, she has this great smile on her face. "Oh my God, you've come back again, you naughty boy. Okay, don't worry, we'll look after you." Okay. And in the other one, I said, other one, there's this old man, a black guy, who's so wise. He's the guy who wheels my trolley to the cath lab, right?
Yeah.
And on the way, he talks so wisely and he comforts me so nicely that I feel ki this is the place I must come. When this guy can speak so nicely, others must be also equally good. In fact, there's
Yeah.
this
No,
famous story
that's very insightful.
a famous story of a CEO of an American hospital actually worked as a ward boy for 1 month to see how their life is and see what are the interaction page pattern. See, most of the times the way our porters, the way our nurses talk to our patients make them make repeat buying decisions. They are deciding all the time, is this place worth coming back to? The American hospitals have realized this. They have multi-million dollar compassion training program. You're from Cleveland Clinic. You run a great
Correct.
program there, right? This is
Yes,
one of
thank
the
you.
world's best programs. And
Thank you
Indian
for that
hospitals, we are yet
recognition.
to, Indian hospitals, we have to start doing that.
Right. So, in other words, you're saying it's not the fancy technology, it's really how a hospital makes a patient feel that ultimately matters. That's what aids to a positive patient experience.
Absolutely.
Well,
Absolutely.
so that brings up to my last question for the session today, which is more around digital health and what's the focus, the future of digital health. And since we just talked about empathy in the clinic, at least in the Cleveland Clinic, our teams have begun to discuss, that digital technology is here to stay, even after COVID. Virtual consultations are here to stay. But how, and I think the one downside of virtual visits is, of course, the human touch that we talked about, would be somewhat compromised. So we have begun to discuss, how is it that we convey this empathy? We are almost calling it like digital empathy or e-empathy. I don't even know if that, a
Hmm.
concept exists, but nevertheless, we all try, right? So what are your thoughts on A, the future of digital healthcare in India, and B, if it is here to stay, how do we combat the human empathy piece and how do we ensure that's not compromised?
Let me ask you a question. Do you have an American Express card? I'm sure you must be having.
American, sorry, what?
American Express card?
MX card? No, I don't.
Okay.
I don't.
If you get one, I suggest you do. If ever you talk to their customer care, you see the difference. You see the
I'm
difference.
going to try that.
That's
My
one.
husband does.
That's one amazing customer care. The girl or the boy who will pick up, and this happened with me. "Hey, Dr. Mullick, good evening. How's been your day? And so, what are you doing for your birthday this month?" Obviously, I know that they know my birthday.
Right.
So I mean, the conversation starts like this. They make you feel at home, make you feel welcome. I mean, the way a person talks on the phone without a face, even a telephone talk can be empathetic. And a person can be standing in front of you, and he wants some information. You are a counter girl, and you continue to appear to be busy. This happens in every hospital. Moment that she sees a patient walk up to him, she appears to become more busy with the computer, right?
Uh-huh.
And then he ultimately picks up the courage to come to her, and she looks up at him, and he says, I want to go to Dr. Mathur. Oh, idhar aage. She won't even smile and say, I'm sorry, sir, let me take you there. She can always get up and take him to the doctor's chamber. She doesn't do that, right? And even if you're talking on telephone, you can be very, very empathetic. And Amex. The Amex experience is amazing. Amazing. Full marks to them.
I'm going to try that out. I'm going to try out the experience with them.
You
Thanks
should. You should. You
for
should.
sharing, that little bit of info. Now, diving down to, let's talk beyond empathy for digital health, right? Where do you think, India is with regards to integration of healthcare data? We have the billing systems, we have, our hospital systems. Do you think we are ready to actually use this data to make an impact on outcomes? And are we ready to have the conversation around artificial intelligence?
Not yet. See, all the pieces are there. The AI pieces are there. Very good EHR systems are there, which are very cheap compared to international prices. But hospitals, as usual, they need a push, and the push needs to come from the government. Government, where there are some pressure groups, they have created the EHR standards. The Indian EHR standards version 2 has come up. We were all hoping once version 2 come up, the government will come with a carrot and stick that you have a EHR, then you get 15% more reimbursement in this, and you don't have it, you'll be penalized, stuff like that. That is yet to come. I don't know for what reason. But I'm sure somebody must be working on that. Once that comes, this will start happening. On the other hand, lots of hospitals have realized the benefit of this. It saves them space. Big hospitals use humongous amount of space for keeping their records, medical records, right? And medical records have their own problem. They get lost, right? They get destroyed. You have a fire and you lose all the records, then there's a separate bit of litigation. And then you can't do, as you said, you can't do research properly. Data is not available. So lots of hospitals on their own are investing money and time and effort to become paperless. And it's only when you have EMR. Now the hospitals have also realized that once they create digital data, clinical digital data, they can monetize it with drug companies,
Mm-hmm.
isn't it?
Data is currency. Yep.
Yeah, exactly. It's a huge 700 bed, 1000 bed hospital chain. Once he has 1 year, 2 year worth of digital data, after de-identifying it, it can monetize it. It can actually involve drug companies and drug research companies to come and have a look at it for money. So there are lots of benefits, and hospitals are now going in to become digital. All the pieces are there. They are reasonably cheap. Only, of course, there's some money to be spent in any case. And this we have seen in India also. Once a consultant, a doctor goes digital, he will never go back to paper. Never go back to paper. See the amount of convenience. This fellow has got live ECG trace, live SpO2 trace on his mobile for a patient who is lying in the ICU. He knows that this patient is getting through the syringe pump this medicine as 50 mics per minute, right? He knows that the
Right.
nurse is giving the right dose, right?
No, I
He
think all that makes sense. Now, with regard to quality data, I must say, in the US, consumers are able to look up, hospital. We have so many grading mechanisms for healthcare consumers to evaluate which hospital they might want to go to, right? Whether it's quality data, whether it's patient satisfaction ratings. Uh, where, when do you think India will get there? Because, even today I feel the referral patterns of, patients are mostly by word of mouth, or what, your friends, whom your friends have visited. But this whole transparency around outcomes or even patient satisfaction data, I feel is very critical for,
Yeah.
the generation today, the generation XYZ, right? I mean, we're all been now, very used to data. So where do you think India is with regards to transparency of healthcare data?
Yeah, the good thing is patients are checking up hospital scores on Google, and hospitals are starting getting concerned on that. Hey, how do I improve my Google score? You need to do better patient care. Patients should be happy. So hospitals actually started investing and doing some efforts in towards that direction. As far as clinical outcomes are concerned, great idea. In America also, this idea ultimately fructified because this huge pressure group came up, the leapfrog group, right? It started with the leapfrog pressure advocacy because they were a whole bunch of consumers. I expect some big consumer group like that in India will also ultimately come up to force hospitals. But on the other hand, Indian hospitals on their own started doing that. In my last hospital, a big cardiology cardiothoracic center, the owner is a cardiac surgeon, and he says, I want to know how do we compare to anybody else. I said, okay, I mean, there are standard set of outcomes, let's start measuring them. We picked up data, genuine data. It's all on paper. So we created a team. We validated and doubly validated data. And then guess what we found? Out of 10 outcome measures, they in 5 of them, they were better than the NHS.
Wow, that's encouraging.
Okay? Yeah, that's very encouraging.
Mhm.
So,
Yeah, because
and
I
they
think
said,
there is still this data fear and you start comparing, but I think it has
people are
immense power to
unnecessarily afraid.
improve
Yeah,
and
we
even
have
to
great
validate that you're
doctors.
doing the right thing.
Absolutely, we have great doctors. We have great systems, at least on the clinical side, and doctors have great amount of respect for their own work, right?
Hmm. Hmm.
And when they know, oh, we are as good or better than the NHS, they really they went out of their way to thank us. Hey guys, I mean, let's continue to do this. Let's post this on our website, and we started publishing that data, right? So that will happen. That will happen.
Well, Dr. Alok, I think this was very insightful. And, this is at least one of the first times I've heard such positive feedback about reporting outcomes. And I am certainly very motivated that, I will see more of transparency in outcomes data and in the use of digital technology in healthcare, while making sure we put the patients first. So I am motivated this Monday after this conversation with you, and I'm sure our audience was. I am so thankful for you, to have taken the time out on the busy Monday out of your square schedule to dedicate time for Voice of Healthcare. And I again thank Voice of Healthcare for hosting this show for the welfare of the patients and the healthcare community. Thank you.
Thank you, Deepika. Fingers crossed for whatever we discussed. I'm sure it is going
Absolutely.
in the right direction.
Ab- Absolutely.
We all wish that it would happen faster, but things take their time. In healthcare, we have learned one thing the hard way, that things take time to change.
Yep. We'll all get there.
Yeah, we all got
All right.
definitely. The movement is there. We'll all get there.
Thank you again, Dr. Alok, for those
So
wonderful words of wisdom this
wonderful
Monday.
talking to you.
Yep. Likewise.
Bye bye.